Thank you, members of press. I'm Dr. Omondi Stephen, the branch secretary, South Rift. Today we held a peaceful demonstration in Nakuru County just to tell the government that we are out for a reason, and if those reasons that we enlightened in our strike notice of the 6th month are not solved, we are not going back to work. So basically our peaceful demonstration was to urge the government to fasten their belt to ensure that the issues on the table are solved as quick as possible to prevent the ongoing doctor strike and to prevent the suffering of the common mwananchi. As you know, the things that we want the government, both the national and the county, to implement. There are things that were already discussed and agreed upon. We are talking about the posting of the interns. This is something that is already there. The policy is there. The period that they should stay out is there. The amount of money they need to be paid is there. And these are not any other intern. So by somebody coming out as a cabinet secretary and through a name of a commission called SRC to come and try to slash the salaries of interns, this is something that was negotiated. It is in the policy, it is documented, and they know the service that these guys offer in these hospitals. I can tell you for a fact, go to these facilities. When you don't have those interns, there's nothing. They work for like 30% of all the workforce in our facilities. Number two, we have the CBA 2017 to 2021. Before the 2017 strike that lasted for 100 days, we had a CBA that was agreed upon in 2013. But the government said that the person by the name PS then who signed the document was not an officer of the government. So it made the strike go longer to 100 days, and we agreed to come up with another CBA, which is 2017-2021. And we knew these tactics of this government. We knew they might again change. Like now, they are saying that some of the governors are saying they were coerced to sign in this CBA. That is nonsense. So they agreed to sign on into it. The SRC signed in onto it. The government signed onto it. All other hospitals, the national KNH, KU, and TRH signed these CBAs. And they know what it entails, and it was deposited in court. And they know what they owe the doctors of this country. So we cannot again be just going back and forth on something that we already agree upon. We as doctors, we can't be tossed left, right, and center. We know our worth. We know why we go to school for those years that we go to, and we have no time for other things. Our only time is with our patients. But if you force us to go to the streets, we'll also force you to ensure that you do what you need to do. Number three, we have the issues of registrars. In this country, we have a shortage of consultants. That one we agree. All of us, doctors have gone to school, they have started working, they have started their work, they have again been sent to go and study to different specialties like a country. We have a shortage of oncologists. These guys have taken their time to go back to school so that we can build capacity as a country. The government promises that it's going to pay for their school fees. It's from 2018. Somebody is in school, his or her school fees has never been paid. The university is denying him exam. He's working day and night shifts, more hours in our referral hospital without any pay. He's denied opportunity to graduate. As a country, where do you want us to head on? And we have a policy that regulates this. So if the registrars will not also have their school fees paid, will not go back to work. We are now talking again about UHC, SHIF. We don't know what was wrong with NHIF that has denied most of the doctors medical cover. And now we are saying we cannot provide a service that we cannot afford. If we'll not have a medical cover as doctors, we'll not also go back to work. Number three, we have a serious shortage in our counties. Then we have counties, one of them Nakuru, whereby is hiring doctors on locum on weekly basis. Yeah? A doctor sees you today, next month you go to the hospital, because for a doctor you need to do follow-up with the notes. You find the doctor that saw you last week is not there because he has been employed as a casual. We cannot work very hard to work as casuals. So if you are not going to convert our doctors on who have been employed on very awkward contracts, we'll also not go back to work. So those are the bare minimums that we have, and they are in our CBA and in the strike notice. And other issues like promotions, we also need car loan and mortgages. We struggle very hard. Why should we have the MCAs, MPs to have the car loans and mortgages while doctors are working? And I'm called at night to go and offer service. So that is also part of the things that we want to be served.
Thank you very much. On behalf of the registrars, we are suffering. I'm here doing my residency in surgery, and I'm very, very sad by the government. I don't know how incompetent Nakumicha can be, and we need the higher government, Mr. President, His Excellency, to address this issue, because Nakumicha has expressed gross incompetency, and we can no longer sit down with that to address this. That's arrogance of the highest level. We work here and we're not paid as registrars. Recently, the counties chipped in and said we're not going to be employed while we're doing our residency. You can't be treating us like ordinary interns. We are different. We are junior doctors, and we are about to become consultants soon. Please treat us with the utmost respect that we deserve, and we are not going to stop any time. We're not going to stop any sooner until our issues are addressed. Let them bring sober minds. It's not a competition. We're not at war with anybody. We just want the common mwananchi to benefit. So thank you. Yes. My name is Ayugi Ochieng. Yes, Dr. Ayugi.
Thank you. Thank you.
Members of the fourth estate, thank you so much for this opportunity. I'm representing the interns in the country, and even the young medical officers who are unemployed. And it's sad for us to find ourselves on the streets. Normally, this is usually our last option. We wouldn't want to hurt our patients for fighting for salary, but when you see the way things are happening, the government has forced us to be here where we are. As medical officer interns, we normally do the majority of the work, and at least in a week we only manage to sleep for around 40 hours a week, because most of the time we are actually in the facility. And the government has really delayed to post the medical interns, and the other interns who are in the January group left us. They went, so we are very few in the rotation. Like you find a rotation has just one intern, so you have to do calls every day, and you have to be in the facility. You have to do cesarean sections and appendectomy. So it's usually very tiring, and we really need the other interns to join us. It's so unfortunate that they are cutting the salaries of the other of the interns who are coming. The new offer by the SRC, that pay is really not something that can hold waters, because as you all know, interns don't live in the facility, they live very far. So even that one can just only cater for transport. So when they do that, they really demotivate the interns, and you will not be able to see our patients comfortably. So they should be able to post the interns. And one thing special about the medical officer interns is that they are not like the other interns, because what we normally do is that you have to be fresh. When you come from campus, you have learned how to do a procedure. You don't need to sit outside for 7 months or 1 year, because that one now you'll have to do a refresher. And now doing that refresher, now you're practicing on a patient, you end up messing a patient because you have not been in the field for so long. So they are not supposed to be any form of delay for posting of the interns. So let them post the interns, and even after that, they should be able to employ the doctors, because even as the interns who are leaving in the next few weeks, we are not sure if we'll get the jobs, because there are no other jobs that have been provided. The other day you saw the contracts have been given out. People the county offers us to employ people, but so far nothing has happened. And you even know when we go for interviews, not all the interns will be absorbed. So they should just do the bare minimum, and at least make sure that at least the interns are able to enjoy. Give them a salary, at least wajipange, they open even their clinics, and then they're able to be comfortable. So students are, and then also for students, it's so sad when you are a student trying to revise for surgery, and you are seeing the salary cut. You are seeing that you are given a gross salary of 47,000, and that means that when it comes to net salary, you're earning almost 20,000, and you are studying for medicine. You have studied very, very serious books. It demotivates you even to learn and acquire the skills that you need to practice on our patients, because our patients are human beings and they are special people. So you can't treat them by treating the doctors the way they are treating us. So let them post the intern, let them implement the CBA, and let them not offer the threats that they are offering to other doctors. Thank you so much. Gina Dr. Bero. Yeah, medical officer intern at PGH. Yes. Dr. Stephen Obiero. Yes, thank you.
My name is Bravian Kaunda, and as my colleagues have insinuated here, it's quite sad that doctors have to go to the streets to actually make the government listen on an issue that is important as healthcare. According to Kenya is a signatory of the Abuja Declaration. We're supposed to spend a much more significant percentage of our national budget to healthcare. Right now we are doing 6%. Now there's this thing that they say that Kenya is producing many intern doctors as students, and we have an ability to actually sustain them in the hospitals. And to that, we have to realize that there's a massive shortage of doctors in the country. We will need up to 50,000 new doctors to fill this particular shortage. And those doctors do not come from anywhere. They come from the students, and those are the students who we are trying to get them to actually reach there. That's why the universities have been increasing their intake. So when the national government says that the numbers are unmanageable, the population has been increasing from 2014. It is only commensurate that the number of medical students and interns is going to increase, and the number of patients are increasing. So I think at this particular point, we have to be fair to all of us, all of these students, your brothers, your sisters, your parents, and even if you do not know them, the fact is, one time in your lifetime, they're going to actually look after your particular needs. So let us not be combative as the government wants to make this particular thing, but actually look at the policies in existence. Let's look at the realities of how the admission set are at, and let's look at how even Treasury plans. So if you say that you do not have the budget for it, we have had, there's 4 billion for tea. What's another 2 billion shillings for doctors? So I think we need to have candid conversations regarding these particular issues. Thank you.
Okay, my name is Gakim Withali. I'm the current Vice Chair of the Clinical Medicine Students Association Kenya, and I'm here on behalf of the BSc Clinical Medicine students and interns. It is so unfair to what the government is doing to us, and the amount of hours we put into the work, into studying for this, and the amount of money we pay for our fees is not equivalent to what they want to pay us. And for all those things they are claiming, we do not accept. We stand in unison and in solidarity with KUKO and all medics, nurses, nutritionists, and we say we do not accept. We want proper remuneration of our clinical medicine BSc interns. Thank you.
President.